Hello and welcome to this short video on understanding periods and cyclical symptoms in persistent pelvic pain. Hopefully this session gives a nice baseline understanding of hormonal cycles to help make sense of information in the next video around use of medications and hormones. Even if you're currently on hormones or medications that are suppressing your cycle, we think it's important to know a little bit about how your biology works, because so often our periods and what's going on in our pelvis become something to fear. And helping to understand it can help reduce fear and build safety in your body. On our group education page on our website, there's a recording introduction to our group sessions, and in this we discuss some of the many potential contributors to pelvic pain. If you haven't watched this video, I recommend you go back and give it a watch to give this some context. But in this presentation, we'll largely be focused in on the uterus and ovaries and periods as contributors to pain. If we look at this diagram of the pelvis, this is a side-on view, you can see how much is crammed into a very small space. On the left-hand side of the screen, you'll see at the front, you have the pubic bone, and then sitting behind that, the bladder, and behind that, the vagina, cervix, uterus, fallopian tube, and ovaries, and then at the back, your rectum and colon. Sitting underneath all of these is your pelvic floor, so a sling of muscles that sit and hold up all of these organs. And then underneath the pelvic floor muscles, you'll see the external genitals, so the clitoris and the labia and the entrance to the vagina and the urethra. This is a front-on view of the reproductive organs. So again, you can see the vagina leading up to the cervix, which is the entrance to your uterus, the fallopian tubes on either side of the body of the uterus, ovaries, and also sitting on either side. The lining on the inside of your uterus is called your endometrium, and this is what thickens up each month and is shed as a period if you're not on any hormones to suppress this or you're not pregnant. Two conditions that may be associated with pelvic pain and might be relevant to you are endometriosis and adenomyosis. So on the left, endometriosis is an estrogen-driven inflammatory condition where you get deposits of cells that are like the endometrial lining of the uterus, but they're outside of the uterus. So this is commonly behind the uterus, on ovaries or the tubes. Whereas on the right-hand side, we can see adenomyosis, which is a condition where the endometrial cells are found invading into the muscle layer in the wall of the uterus. This presentation won't go into any more specific detail about these conditions, but we do have a video recording on our website with a local gynecologist doing some myth busting around endometriosis. And I also recommend having a look at the video recordings done by the Julia Argaroo Centre for Endometriosis at the Epworth. And they have a series of webinar recordings, including the one listed at the bottom of this page, which outlines the steps to an endometriosis diagnosis, if that's something that you are seeking, and it includes a discussion with a gynecologist around why surgery might not always be necessary. What's important to note is that whether you are diagnosed with these conditions or not, a lot of the medical management recommendations for pelvic pain are similar and focused in on trying to reduce periods and bleeding. So a quick introduction to the main hormones for women or people assigned female at birth. This slide looks a little bit scary, but it's just to say that your ovaries and brains are in constant communication with each other. Your brain releases hormones that then act on a gland at the base of your brain called the pituitary, which then releases hormones that stimulate your ovaries. And your ovaries make your two main hormones, estrogen and progesterone, and to a lesser degree, testosterone as well. So estrogen and progesterone are the two main hormones involved in our menstrual cycle, and they feed back information to the brain, and these feedback loops lead to ovulation or egg release. If an egg is not fertilized, this then leads to a bleed or a period at the end of the cycle. The swings in hormones that you can see here also contribute to other cyclical symptoms that you may experience. So things like mood changes, sore breasts, headaches, and skin changes. We can use hormonal medications to act on this signaling to change our usual cycle and related symptoms. It's also important to note, though, that this cycling can also be impacted by other hormones like thyroid hormones, insulin, cortisol, as well as stress or illness. So it's important to consider and address those as well. If we talk about the menstrual cycle, a cycle lasts from the first day of your period until the first day of your next period. We'll speak about a 28-day cycle, but depending on your age, anything between 21 and 35 days is generally considered normal. Ovulation or release of the egg usually happens around 2 weeks before your period, so around day 14 in a 28-day cycle. If you have a longer, say a 35-day cycle, this ovulation will happen later, around day 21. It is the days leading into and the day after ovulation that you are most fertile, if you are wanting to fall pregnant. It's also important to note that this is just a guide. Our bodies don't always work exactly like clockwork. There's a degree of variability month to month, and some months you may sometimes have cycles that you don't ovulate in, or when you might ovulate at a different time due to stress or illness or medications. But this is just a good rough representation of what's happening throughout the month, starting with your period and shedding the endometrium. Then throughout the cycle, the endometrium thickening up again in preparation for a potential pregnancy. And then if you don't fall pregnant, then that lining being shed as a period and the cycle starts again. In the next few slides, we'll break down each of these stages a little bit more. So phase 1 of your cycle is the menstrual phase or the period. As I said, day 1 of your period is day 1 of the cycle, and this phase usually lasts about 4 to 7 days. During this time, you're shedding the endometrial lining that has accumulated over the previous month, and that process releases prostaglandins, which are inflammatory substances that can cause other symptoms as well, like migraines or changes to your stools. As you can see on the right, your hormones are at their lowest in this first week of your cycle. And so you may also note low mood and low energy and feel like you just want to curl up in a ball during this time. Once your period stops around day 5 or 6 until ovulation, this is the follicular phase. During this phase, hormones from your brain are stimulating the ovaries to develop and release an egg. As you can see on the graph, this process causes an increase in estrogen production, and many people may start to feel more energized during this phase. You might start to feel more social and want to move your body and get out again. The estrogen starts to stimulate that endometrial lining again, and it starts to thicken in preparation for a potential pregnancy. This estrogen rise will also be stimulating any endometriosis deposits outside the uterus. Just before ovulation, the ovary also makes a little bit of testosterone, so you may also notice a higher libido at the end of this phase and a change in your vaginal discharge, which can become a bit stickier and more of it. Once the estrogen rises to a peak, it triggers the ovaries to release an egg. It's around day 14 to 15 of a 28-day cycle. And then we enter the early luteal phase. This estrogen peak may make you feel more energetic and social, higher libido, and discharge at ovulation is typically more wet and slippery. In the process of ovulation, the egg is released from a follicle, so a small sac of fluid, and that fluid release comes with some more prostaglandins and inflammatory substances. So ovulation for some people with pelvic pain can cause an increase in pain and bloating at this time, and the fluctuations in hormones can also change pain sensitivity. After ovulation, your ovaries produce more progesterone hormone, which can, for some people, lead to feeling a bit more relaxed and calm in this early part of the phase. But if the egg is not fertilized, meaning you haven't fallen pregnant that cycle, your estrogen and progesterone will then decline in the 7 to 10 days leading up to your next period. So around day 21 to 28. This drop in hormones leads to premenstrual symptoms such as mood changes, headaches, bloating, food cravings, or breast tenderness. These can range from mild to very severe. So, in some cases, in conditions like PMDD or premenstrual dysphoric disorder, this can even be as severe as suicidal thoughts in this phase. If this is the case for you, please reach out to your healthcare team. The drop in hormones at this part of the cycle leads to that thickened endometrial lining becoming unstable, and those inflammatory prostaglandins are released again. So you may start to get cramping and pain even before your bleeding starts, and then the cycle starts again. So as you can see, some degree of discomfort and mood changes with cycles are considered normal, but pain that is stopping you from working, socializing, or studying, or mood changes or premenstrual symptoms that are significantly impacting your life should not be considered normal or something that you have to put up with. And we encourage you to reach out to your healthcare teams to discuss this. We recommend now moving on to the next video where we discuss some of the common medications we use to manage cyclical symptoms and periods in particular. Thank you.